So good morning. My name is Adrienne Franklin, as most of you know, and I am the regional coordinator for Tennessee SHIP here in the Mid-South area, covering Shelby, Fayette, Lauderdale, and Tipton counties. And today we're going over SHIP and MIPPA performance measures. And this is, some of you may have attended this earlier, so a lot of this is going to sound familiar. Here's all of our legal logos and legal verbiage at the bottom, so now we're in compliance. But the importance of the SHIP and MIPPA performance measures, they're important for our program, of course, because we are measured by the Administration for Community Living on a yearly basis based on our performance, and you'll see the things that they measure us on throughout this presentation. And this is what helps not just Tennessee SHIP, but all SHIPs. This is what helps us keep our funding. So it's very important that we strive to hit our goals. And the more that we, as staff and volunteers, understand what those goals are, the easier it is that when we report our data, and we'll get to reporting later in the webinar, then we'll understand exactly what information we need to be providing to the volunteer coordinator, who for our region is LaJoy White Pollard. And so that way everything will be recorded properly and in order. We can hit our marks and, all of the nice numerical stuff that they like to look at. So for SHIP, you know that our program has SHIP and MIPPA. So we have two separate performance measures. They do go hand in hand, but we're going to first go over the SHIP performance measures. So as you can see, there are 5. Our first performance measures are the client contacts. So this is the percentage, and I promise I won't read every single slide. I'm just going to kind of go over this one as an overview. But this is our percentage of total client contacts per Medicare beneficiaries in the state. So this is when we have that one-on-one conversation, whether it's by phone or in person, even email or postal mail or online like this. This is when we have that one-on-one conversation with the Medicare beneficiary or their family member or caregiver. So that's the PM1, the client contacts. Performance measure 2 are our outreach contacts. So this is when we are doing outreach through either presentations, booths and exhibits, or enrollment events. So the percentage of persons that we reach per Medicare beneficiaries in the state, based on these 3 types of outreach contacts. And each of these will go into more detail in a moment. Performance measure 3. These are populations under age 65. So again, the percentage of contacts that we have with Medicare beneficiaries, not just anybody under 65. They're specifically looking for people who are under 65 who are eligible and have Medicare. PM4, these are our hard to reach clients. And I'm sorry, but I really want to put some hyphens in that hard to reach, but I didn't make the slide, so I'm going to leave it alone. But you can see it's here in the gray part. It's got hyphens. Percentage of low income, rural, and non-native English contacts per total, quote unquote, hard to reach Medicare beneficiaries in the state. And then we have our 5th performance measure, which is enrollment contacts. So these are the percentage of unduplicated enrollment contacts discussed per Medicare beneficiaries in the state. And that one will require definitely a bit more conversation, so I'll just save that for when we get to that page. So our first performance measure, again, client contacts. So you can see the definition there. So all of our beneficiary contact forms, and that's regardless for whether we, have that paper form, or I know some of you do a spreadsheet, but any way that we capture the information for when we have contact with a beneficiary or their representative, and then also any additional sessions, because we know sometimes it takes more than one contact with a person to complete their case or to really get to the heart of what they need. Or sometimes they just think of something totally different, contact you later. So these are all of those contacts and additional contacts where we have those one-on-one interactions, where we discussed Medicare information or SHIP program information. So as you can see on the left-hand side, it tells you what types of contacts this includes. So any in-person contact, whether it's at a counseling location or at the person's home. If we speak to them by telephone, email, postal mail, fax, and web-based. So if you have the ability to speak with someone over WebEx, which is the platform we're using, GoToMeeting, any of those types of platforms where you're able to have that online experience with someone, which can be helpful, especially for people who, during COVID, don't want to get out, or maybe they don't have the ability to get out, but they still kind of need to see a little face to face. And just like I'm doing now, you can also pull up the information you're talking about and they can see it as opposed to just hearing it over the phone. So any of those types of contacts would count as a client contact. Now, what does not count is when we have an unsuccessful attempt to reach them. So if you leave them a voicemail, that's good. We want them to call us back or at the very least email us back, but that's not a contact. That's just leaving them a message. So you cannot complete a beneficiary contact. You can't complete a STARS contact just based on them having leaving a voicemail. Now, once they get back to you, then of course that conversation can be included. Individuals reach through public events. So, if let's say it's, the Delta Fair and you've got a booth, and so hundreds of people come by and, they grab your flyers and everything. While certainly that counts as outreach, which we'll get to later for PM2, that's not an individual contact unless you do stop and actually speak with someone, or maybe they write some information down and you exchange information that way. But so unless that happens, you can't just go, oh, I have 500 people, I've got 500 client contacts. No. It has to be more meaningful than that. And then contacts when the only purpose is to schedule an appointment. So when I call someone and all they want, they leave me a message. They might send me an email or leave me a voicemail saying, "Oh, I want to set up an appointment to talk with you, whether it's in person or whatever type of conversation." And so I call them back. "Hi, so is Tuesday the 15th at 3 o'clock? Okay, sure. Okay, bye." If that's pretty much the only conversation we have, that's not a client contact, which is why I do try to sneak in a little bit when I schedule the appointment. I think the last time I did that, I scheduled the appointment. I said, "Oh, and by the way, so do you have Medicare?" "Yes." "Oh, great. And are you looking for Medicare Part D information?" "Uh-huh. Well, you know the open enrollment is," and I give them the dates. Bam. I can actually count that because we did at least talk beyond just setting an appointment. But if all I did was say, "Hi, I'm Adrienne, so what's Friday look like to you?" "Looks good to me too." "Cool, bye." Then that's not a client contact. And mass emails. It does not include mass emails. Now, outreach contacts, performance measure 2. So again, this is when we report how many people we reached when we did some form of outreach or education. And so sometimes we have an exact number, especially if we have a sign-in sheet. Sometimes we may have to eyeball it if they're in the room and, they participated, but maybe, you kind of did a head count yourself or a close enough approximation. Or I know one time I knew I had how many brochures on the table, and then when I counted how many were left, okay, bam. So now I know how many came because that's how many moved, unless somebody grabbed two. Hey, this is good a way to figure it out as anything else. At any rate, so your best, ability to count the number of people that not only attended your event. And so you want to monitor that attendance, give them an opportunity to ask questions. Especially like if it's this type of situation, if you're doing a webinar, you definitely want to make sure that they always have an opportunity for Q&A. That doesn't mean they have to take you up on it. That's their business. But as long as you provided the ability for interaction, then that counts as outreach. Being on the radio or a TV ad or even a TV interview, that's not a group outreach. That's media, but that's not group outreach. But if you're doing a webinar or if you're in person at a fair or something like that, and there is the opportunity for interaction, you're doing a presentation, whatever, then that counts. So over here, you see that pretty much everything I just babbled about is on the left side of the chart. So presentations, whether they be in person, webinars, teleconferences, booths and exhibits. So again, this basically just means a table, although you certainly can have a tent too. But if you have a table or a space at some sort of event, whether large or small, it can be a large event like Delta Fair where we're able to secure a space and have a table. It can even be just something like, oh, my church is having the church picnic, and Pastor said I could put a table out and put my stuff if I wanted to. And, while people are throwing the frisbee, they can come by and get stuff. The mother's ministry came by and grabbed some stuff. That counts. It's still a table at an event. So that is where you're sitting there or somebody's sitting there and you're providing that information, and there is the opportunity for interaction if they so choose. And then enrollment events, which is what we are going to start having on the 15th. We're going to have events, as you well know, or if you don't, give us a hey holler and we'll send you out the calendar. But we're going to start having our Medicare annual enrollment where we go to different locations and we assist people with reviewing their Medicare coverage, and if they so choose, even enrolling in a different plan. This can also be if you had an event where the purpose was to help people um, apply for low-income subsidy or for the Medicare savings plan. So if it was solely focused on that, that's still an enrollment event. If it's the type of event we're about to have, if it's a combination of the two, those would be enrollment events. So those are the three types of things that counts as outreach contacts. Now, this does not include, I mentioned before, radio and TV, also social media. We try to post up a storm on our social media pages, but that's still not group outreach. It is media outreach, and it's important. We want to spread the word, but that's not group outreach. And you can see all of the other different types of things there. This is very important, this also does not include mailings. A mailing, as we saw before, is a beneficiary contact. So right now we are in the midst of mailing out to everybody that we've had contact with in the last year or two. We've got their files, we've got their addresses in a database. And so to remind them that open enrollment is coming, and we're sending them a worksheet in case they want to send us their information back by mail. We're sending them a calendar to let them know where we're going to be during the next 7 weeks if they want to come to an enrollment event. So we are contacting them by mail. The reason that counts, even though it's a mass mailing, is these are people that we have had previous contact with. So that means we do have the right, we do have the permission to reach them again. So just because I'm reaching 500 of them, but I'm reaching 500 individual people. So those are client contacts. That is not a group outreach. Well, it's a group of people. Well, heck, man, if I walk around the corner and see a bunch of people standing there, that's a group. But if I talk to them individually, those are individual contacts. So, yes, mail outs are not group outreach. And I know there was some confusion about that with some folks. I just wanted to make sure that that was clear. All right, so moving on to our next performance measure. We're looking at Medicare beneficiaries under age 65. So these are people who indicate that they're not only under age 65, but that they are either receiving or applying for Medicare and Social Security benefits due to disability. So if they meet both requirements, because we know that sometimes we get contacts from people who are under 65, but they're not disabled, or at the very least, they don't receive and they're not trying to receive Social Security disability benefits. These are folks who are just diligent in trying to get information ahead of time for when they turn 65. So we get a lot of 64-year-olds who are like, hey, I'm turning 65 in December. Help me out. Okay, cool. That's awesome. That's a client contact. That definitely helps us with PM1. Has nothing to do with PM3. That person is not disabled. That person is just anticipating happy birthday to them. They're going to be 65 soon. But this is for people under 65, and they either are already on disability or they are applying for disability, which means that will enable them in the future at some point to be eligible for Medicare. So that's PM3. PM4, hard to reach, with my happy little hyphens, hard to reach contacts. So again, there are different categories within this category. So if somebody qualifies as low income, meaning that their income is below 150% of the federal poverty level, that's considered a low income contact. So 150%, that is the highest amount that you can make in order to be eligible for the extra help, also known as low income subsidy, that's provided by Social Security. So if somebody either receives extra help or would be eligible for extra help, anybody in that category would qualify as low income. And so you can simply just ask them. There's a variety of ways you can figure this out. You can just straight up ask them, hey, what's your monthly income before they take out deductions? Some people don't mind answering that. Some people mind very much. So, just use your best judgment there. You can also just do one of those. Hi, so is your monthly income above or below whatever the amount this year is, which for a single person is $1,630. For a married couple, $2,198. So if you want to do it that way, so that way the person doesn't feel like they have to give you an exact amount, but they can just say yes or no that it's above this amount, and then that can tell you. You can also talk to them about, are you having a hard time paying for your medications as well as anything else? Some people use that method. Personally, I like the first two better because a lot of people have a hard time paying for stuff. Doesn't necessarily mean they're 150% below, but if that's the best way you can approach it, if it looks like they're going to be sensitive about giving you numbers, then you can certainly try it that way. Rural contacts. So as you can see here, they give you the nice legal definition of what means rural, so I won't read that to you. For our region, which again, we only have 4 counties in our region, and that's because that's enough. We have Shelby, Fayette, Tipton, and Lauderdale. Lauderdale County is our only rural county. And no, I don't want to hear it. Yes, I know. Those folks out in Rossville and Fayette County are country, and I can say that because those are my cousins, and if they're mad, they'll get over it. So just because we consider them country doesn't mean that the nation, that the federal government considers them rural. So we definitely have to go by their definition. So anyone in Lauderdale County, that would count as a rural contact, and therefore that would meet PM4. And then non-native English speakers. So if someone, if you want to ask them the question that if English is their first language, you can do that. Sometimes you can just tell by speaking with them whether or not English is their primary language. Or if you're talking with someone who is speaking on behalf of a family member and they outright tell you, oh, I'm doing this for my mom, she doesn't speak English. Well, that answers your question right there. So that's how we meet that hard to reach. So any of those three. And of course, some people cross 2 or all 3 categories. So, but that is how we would meet our 4th performance measure. And here you can see just some technical stuff. So this is how they calculate it. This is how they do the math. If you're interested in that, yay. And I will be sending the PowerPoint. So I'm not just being funny. And I don't know if I'm actually successfully being funny, but I'm also letting you know you will get this. So if you are interested in the minutia of the numbers, then you'll definitely have them. But I won't belabor the point here. And then PM5, those are our enrollment contacts. So again, they're talking about total unduplicated enrollment contacts as reported on either the beneficiary contact form or when you do an additional session with the person. It includes 18 possible topics, which we'll get to in just a moment. If a form has more than one topic selected, they're still only going to count that once. So let's say you're speaking with John Doe and you actually managed to hit all 18 enrollment topics. Great. That's still only counted once as a PM5. But let's say that you speak with John Doe on today and you talk about 2 of those topics. Then next week you speak with John Doe again and you speak with him about 4 completely different topics than you did the first time, but they still are in that list of 18. That's considered an unduplicated enrollment contact. So in that case, it would count a second time, even though it's the same person. So that's what they mean by total unduplicated contacts. Oh, I did see a couple of pop-ups, so it looks like some people have entered recently. Thank you all for joining us. And if you have not had the chance, please type your names in the chat. And if you don't know where that is, it's that little thought bubble like you see in the comic books. Just hit that and type your name, and that way we can make sure to give you credit for attendance. And so now we're going to show what those 18 possible enrollment topics could be. But not all at once. So here are some categories. So if you are using either the beneficiary contact form, which we can definitely distribute to everyone by email if you don't have it already, or if you're just, entering in STARS directly, maybe you wrote this down because you were in a hurry and didn't have a form, but you wrote down enough information so that you were able to go back in there and, fill this out, then these are what would count as an enrollment contact. So for original Medicare Parts A and B, as you can see, there's several different topics you can have, but the only ones that would count towards our 5th performance measure are either eligibility or enrollment/disenrollment. So if you select either of those, then that's going to count towards PM5. I think back in the day they used to count benefit explanation, but they don't anymore. Now, please don't take this to mean that you should not, be utilizing the other categories. By all means, help the person with whatever the heck they need. If they need to talk about coordination of benefits, what pays first, what pays second, you should definitely do that. But, whenever you're able, at least try to slide one of these enrollment contacts in there. And I know sometimes you may not be able, but just to the best of your ability, you're going to want to get at least one of these checkmark topics that we're going to be going through over the next few slides. So again, for original Medicare, whether you're talking about A or B, their eligibility or enrollment. Now, of course, we don't enroll anybody in Parts A and B, Social Security does. But if you speak about that process, which I do on a regular basis, because some people actually think I can do that. No, you need to go to ssa.gov, or let me give you the phone number of the Social Security office that's for your zip code, because you can give them the national number, but I like to give them a local one. That counts. Or sometimes I'll send them a handout that discusses the dates and deadlines for enrolling in Parts A and B. That also counts as an enrollment conversation. So, yeah. For Medigap, so those Medicare supplement plans, if you select eligibility and screening, plan non-renewal, or plans comparison, then that's an enrollment contact. So eligibility and screening, just letting people know when and how they would be eligible to get a supplement plan. Plan non-renewal, if the person tells you, I'm so sick of Plan X. I was about to say a name, but I don't want to do that. I'm so sick of Plan X. They keep going up every year. I'm going to get rid of them. What should I do? Or plans comparison. We do have a handout where it does describe the standardized, because we're in one of those 47 states where Medigap is standardized. So if we either share the information as to, well, a plan G would cover this, a plan F would cover that, or if we send them that information so they can view it for themselves, I kind of do both, because who wants to hear all 8 plans run down over the phone? So you can describe some of it and then send them the information on the rest. Those are plan comparisons. And of course, we do have a tool where we can do some pricing that works for some people better than others. But at any rate, when we do that type of conversation, that would count as plans comparison for Medigap. All right, so looking at Medicare Advantage and Medicare Part D, the same topics for both count as an enrollment contact. So if you go over their eligibility and screening, and again, that could be as simple as, do you have a Medicare Advantage plan or a Part D plan? Bam. You're screening them for whether or not they even have it. Seeing if they're eligible to get it for Medicare Advantage. So do you have Part A only or Part A and B? Because some people go, oh, I want a Medicare Advantage plan. Okay, so do you have both A and B? No, I just got Part A. Oh, well, you're not eligible until you get Part B. Bam, that's eligibility. If you help them enroll, of course, plan non-renewal and plans comparison. So any of those would count as an enrollment contact, and the same with Part D. And of course, throughout the year, we do help people enroll because people are turning 65 and or retiring, but definitely as we're coming upon annual enrollment period, we'll definitely be assisting people with enrolling into either a Medicare Advantage plan or a Medicare Part D. Now, if a person already has one of these plans and you're putting them in a new plan, then you actually can select both enrollment and plan non-renewal, because they're enrolling in the new plan and they're not renewing the old plan. So that would count. You could do both of those. Oh, and although it's not actually going to show up on any of these screens, let me just say something real quick here about when you enroll somebody. When you enroll someone in either a Medicare Advantage or a Medicare Part D plan, and this is new, this is only been maybe the last year, possibly 2 years, no, the last year that they've been doing this, but ACL, if we select enrollment, of course, when we go down on stars, it has those fields where we put in how much money that they're estimated they're going to spend on this new plan. We're enrolling them in WellCare Classic, and it says that their estimated cost for the rest of the year is going to be $92.50. Okay. And let's say that they had an old plan and that estimated cost was going to be $115.26. Okay, so we put that money down, or whatever the dollar amount's going to be. That's okay. But and we've been doing that. That's not new. We've been doing that. The new part that we've had to do for the past year, and I just want to make sure we're all aware of and on the same page, is when you do that enrollment through Medicare.gov, make sure that, and I know most of us do this part at least, we print off the plan itself as well as the enrollment verification so that they have the confirmation, and we usually give that to the client. Make sure you keep a copy for us because that needs to be scanned and uploaded into STARS, which you don't have to do. You can definitely send that with your BCF form and we can scan and upload that for you. Or if you're like me, I make a PDF out of everything and then I just upload the PDF, whatever floats your boat. But we want to make sure that we have that documentation, whether it's a paper copy that we will scan and take care of ourselves, or if you upload it from the computer directly, whatever floats your boat. But if you're selecting enrollment for either of these, we definitely have to have the verification page that has the confirmation number. We have to have the plan that we are enrolling that person into. And if they had a plan previously, we really need to have a copy of that as well. Now, obviously, newbies who either are turning 65 or they're retiring, so they never had a Medicare plan before, you're not going to have that old plan. You're just going to have the new one and the confirmation. But if they did have a plan before, and most likely you'll at least pull that up so they can see the difference between, oh, here's your old plan, here's your new plan. What do you think you want to do? Then you should have all of that. And we can definitely talk about that later during Q&A. All right. So now here are the rest of the topics for enrollment contacts. For Part D, I'm sorry if everybody could make sure that you mute your lines because we're getting feedback. Thank you. All righty. So here are the rest of our topics under Part D, Low Income Subsidy, LIS or Extra Help. This is what counts: application assistance, application submission, and eligibility and screening. So of course, when you screen them for, is your income above or below, or how much do you make? That right there counts as eligibility and screening. And that counts regardless of whether the person is above. I know sometimes people leave it off. Well, they don't, they can't apply for LIS, but they still get questioned about their eligibility. So you want to check that box. Also, if we do an application for somebody with LIS, that's application assistance. And since in most cases, 9 times out of 10, we're doing that over the computer and the phone anyway, or in person and over the computer, we're going to submit it for them. So usually if we select assistance, we're going to select submission as well. Now for Medicaid, the topics that count are application submission, eligibility and screening, Medicaid application assistance, MSP application assistance, and recertification. Now here for eligibility and screening, you will have to get a little bit more detailed than is it above and below 1630 or 2198, because of course that's 150% FPL, that's LIS. The Medicare Savings Program criteria are lower than that. So in that case, if you say, is it for a single person less than $1,469 a month, less than $1,980 a month for a married couple, then you've gotten a bit more specific and you can check that off for eligibility and screening for Medicaid or the MSP. Application assistance. So TennCare, which is the state Medicaid office here in Tennessee, their application for straight Medicaid is the exact same application as for MSP. If you are assisting them with filling it out and they select both options, that yes, they want to apply for health coverage and yes, they want the QMB, then you can actually select both Medicaid application assistance and MSP. But sometimes people specifically are doing one or the other. So there are times you may only select one of those. Recertification, that's when people get those renewal packets and they need help with that. So that's recertification. And application submission. So there's a couple of ways this can work. Well, about 4. Okay, so let's say you have a paper application and you sent it to them. They didn't want to fill it out over the phone. They didn't have the time or the patience. So you just mailed that to them. That's application assistance. But if you send them a letter telling them, hey, we'll fax it for you if you send it back to us. And I even like to include an envelope with their address on it. I'm cheap. I don't put a stamp on it. Sorry, they can do that. Sorry. You can put a stamp if you want to. And that usually encourages them to send it back to us so we can fax it to TennCare on their behalf. So when we get it back and we fax it to them, then of course that's application submission. So that's one way you can handle it. And that would be 2 contacts, obviously, because you sent it to them on the 5th and then you got it back on the 20th and you faxed it. So that would be a second contact anyway. But another way that you can do application submission, let's say that they are willing to take the time to go over the application over the phone with you. So you're filling it out while they're answering the questions. So you're basically reading it, you're filling everything out, and all you need them to do is sign it. So you send it to them to sign. Again, encourage them to send it back so you can fax it on their behalf. But even if they choose not to do so because they either have access to a fax or they want to roll the dice and mail that thing, and I always tell them, if you do that, please certify mail. But as long as you did the bulk of the work on getting that application filled, and the only thing they're really doing is signing it and dropping it in the mail or going to Office Depot and faxing it, even if they don't let you fax it for them, that actually SHIP does say that that does count as application submission. So that's great. Let's say you do a three-way call with them. Again, if you haven't muted your lines, please do so, so we don't get feedback. Thank you. But let's say that you do a three-way call between the person, and TennCare. And heaven knows I've done that a few times. So basically, the TennCare person is the one who's actually taking the application. You're simply listening. But the reason you're hanging on the line is sometimes that person may not always understand what the TennCare agent is asking, and you might be able to step in and say, Ms. Jones, what they're asking you is this. Not because the TennCare person is doing anything wrong, but there have just been times where I've heard them say it 3 different times, and the person's like, I still don't understand it. So I might go, if you don't mind, let me say, this is what they really mean. Oh, okay, that's what they're talking about. So you're hanging on to assist in that capacity. So in that case, that's an application submission. And then finally, you know that you can do that application online at tenncareconnect.tn.gov. So if you're assisting someone with doing it online, then of course that also counts as application submission. So there are several ways that you can qualify that as an enrollment contact through application submission. But again, any of these check marks will get us PM5 credit if it's an unduplicated contact for that person. So now that I have gone through the SHIP performance measures, now is a good time to stop and ask if anyone has any questions. Let me see if there's any in the chat real quick. But if you want to unmute yourself and ask a question, feel free to do so. And again, if you haven't had the chance to type your name into the chat for attendance purposes, please do so as well. So any questions on SHIP performance measures? Because I know that was kind of an awful lot in a short amount of time. No? All righty. Okay, so let me go back to. Okay, so there we go. MIPPA performance measures. So this is the second half of our performance measures. And if you do think of, oh, I see you in the chat, Alice. No, I couldn't hear you. If you want to type your question in, go ahead. We'll wait a couple of minutes so you can go ahead and type that question. And again, if anybody else wasn't able, if I didn't hear you, I apologize. And if you have a question, go ahead and feel free to type it in now. And while you're doing that, I'm actually going to be very self-serving. You get a drink of water. So definitely feel free to ask your question in the chat. Okay, so the difference between the Medicaid application submission and the MSP application submission. So again, if they've only well, actually the application submission part, let me go back to that slide. I'm on computer. There we go. Okay, so application submission, there's only one button for that. So regardless of whether it's Medicaid or the Medicare Savings Program that they're trying to do, if you help them submit the application, then you just select application submission. But there are separate lines for whether or not it's a Medicaid application assistance and a Medicare Savings Program or MSP application submission assistance. So again, if the person's wanting to do both, you can select both if they're very specific about which one they're doing. In our case, it's usually, if they only want one, it's usually the Medicare Savings Program, although I have had people only want the Medicaid part. And then I've had several people want both. So in that case, you can select both if they want both, but if they're specific about which one, yeah. But if it's an application submission, it doesn't matter. Do we help people with Medicaid? Typically only if they have Medicare, because of course SHIP is about Medicare. Now, if a person calls me and I find out that they're not eligible for Medicare, but they want the Medicaid application, I'm not about to make them hang up, call TennCare, and find somebody to send them a paper application when I got it sitting right here at my desk and I'm not doing anything for the next 2 seconds. So yeah, I'll mail it to them, no problem, and I'll still count it because it's still eligibility for Medicare. They don't have it, and it's still Medicaid application since I sent it. I most likely won't go through the whole shebang with them since they don't have Medicare, but I'll definitely send it to them and I'll answer questions. I mean, they might as well. They got me on the phone, so I'll go ahead and answer that. But yes, typically we are assisting people with Medicare or who are eligible for Medicare. And if they are also eligible for Medicaid, then we can do that application because it's the same application. There's no difference other than which box you check for. Do you want help with this coverage? Do you want MSP? Well, they ask for QMB, SLMB, one or the other. So yeah, no, typically if it's just Medicaid, typically no. But since a lot of people get our number and they don't know that, or sometimes the INA folks don't really ask the question, so they just send it to me anyway, then yeah, I mean, I have no problem putting that in the mail for them so they can handle their business that way. Good question. Very good question. Yeah, well, like I said, if they select that they want health coverage, then yeah, it would count for both MSP and Medicaid. But like I said, some people will say, no, I don't want to apply for Medicaid. I just want to apply for MSP. So in that case, I will just select the MSP. But if they, like if I'm going through the whole application, if they say yes to both, then yeah, you can definitely get credit for both of those. So yeah, it is helpful that way. Cool. All righty. Awesome sauce. All right. If nobody else has a question, another question on that, we'll move on to the whatchamacallit, the MIPPA performance measures. But definitely, if you think of a question, it's not like this is the only time you can ask. So we'll come back to it. All righty. So, whoops, let's go to, there we go, MIPPA performance measures. So all MIPPA data must be entered into stars. This is what the performance measures will count. And here's the timeline. So we're going to skip most of the dates and just get to the one that we're actually sitting on right now, October 1st, 2021. They're going to start adding the MIPPA PMs to QA. What does that mean for most of you? Not a whole heck of a lot. Our office does, we have to go through each year a audit for quality assurance, which is QA. And previously, the SHIP performance measures that we just went over, those were the only things that we were really counted. I won't say counted against us, but let's say if we failed to measure up to the goals, then that could be a finding that, here's where we need you to improve because you're not meeting goals, or great, you're meeting goals, or hey, awesome, you're exceeding goals. So heretofore, only those SHIP performance measures really counted. These MIPPA performance measures, they've been out for a while. I guess in a quote unquote practice format to get us used to it. But right now they're going to start really taking a more, I won't say serious because that means they weren't serious before. It's going to count more like SHIP did. So yeah, we really want to start kicking it into high gear. So anything that we weren't doing very well for MIPPA, it didn't count against us, but it definitely let us know here's where we can improve and we need to give it more weight, more priority. That's the word I'm looking for, priority. Okay. So the criteria for all MIPPA performance measures. So first of all, in order for anything that either a staff or volunteer does to count, that person has to be certified, selected as a MIPPA team member. And everybody who goes through our training is, because everybody goes through training on SHIP, on MIPPA, and on SMP. So all three boxes are going to be checked. So that's not a problem for our volunteers or staff. So we're going to meet that initial criteria. There are some states that that's not true, but in Tennessee, we don't play that. Uh, if you've gone through training, you've either met or heard Lonnie on the phone, on a webinar, or in person. So we've got that SHIP, SMP, and MIPPA thing down pat. But the secondary criteria, this is the one that we've been improving, but we definitely could stand more improvement on this secondary criteria. So the contact or outreach, so this is true whether we're talking about individual contacts or group outreach. We have to select yes on MIPPA in order for that contact or that outreach to count towards the MIPPA performance measures. It'll still count for the SHIP performance measures, but for it to count towards MIPPA, we have to select the MIPPA button. So whereas we had 5 performance measures for SHIP, we only have 4 performance measures for MIPPA. And just in case you think that means less work, no, wait till you see one of these things is broken down. MIPPA performance measure 3 is way broken down. But anyway, I digress. So performance measure number 1, these are the overall MIPPA contacts. So this is the percentage of total beneficiary contact forms per Medicare beneficiaries under 150% FPL in the state. So what they're basically looking at is, are we reaching a certain number of people who are LIS eligible? And they're going to compare it against all of the other people that we've reached. But remember I said for the SHIP performance measures, even if we talk to somebody and they count as above, that's still eligibility and screening. We still select that, and you still want to select yes for MIPPA because you had that conversation, and it allows them to be able to do that fraction. You know, you want to take the number that you're trying to reach, which is PM1, and you want to divide it by the overall, which should be pretty much everybody. So that's why we still want to select yes, even if a person is above FPL, so that could give them the correct denominator. Yeah, the bottom half. All right, PM2, overall persons reached through outreach. So these are the overall persons reached through outreach that we selected as MIPPA outreach. So, well, we'll get into that more specifically in a moment. PM3 MIPPA target population. So we have several populations that would count as a MIPPA target. Those under 65, as we mentioned before, and are Medicare eligible, or soon to be Medicare eligible, and they're under 65 for disability purposes. Those in rural areas, so we've had that Native American, so that's specific to the MIPPA performance measures, not to the SHIP. And then, of course, English as a secondary language, which you see on both SHIP and MIPPA. And then finally, PM4. These are contacts with applications submitted. So anytime we submit an application, whether it's for the low-income subsidy or for Medicaid or the Medicare Savings Program, those submissions count. So that's why I was very specific as to what would count for us to check that box for applications submitted. All right, so overall MIPPA contacts. So in order for us to meet this performance measure, we have to have at least one of these topics. Well, first of all, you have to select yes for MIPPA, which is going to be at the very top of the stars. If you're doing it in stars, if you're filling out the beneficiary contact form, it's at the very top, MIPPA contact, yes or no. So you have to select yes. If you don't, nothing that you put down here is going to matter for the performance measure. So you have to select yes, that's the first thing. And then you have to have one of these topics. So under Part D low income subsidy, you see there are 5 topics that would count. Under Medicaid, you see there are 7 topics that would count. And even under additional topic details, preventive services, that actually counts as well. So going back over to Part D low income subsidy, we already talked about application assistance, submission, eligibility, and screening, so I won't go over that again. But in this case, you can select benefit explanation. That doesn't count for a SHIP performance measure, but it does count towards the overall MIPPA performance measure. So if you explain to somebody what the LIS is and you check that, that will count for overall MIPPA. And then LINET/BAE, when you talk to people about LINET, that's that program where, let's say that Jane Doe has applied for the LIS, but she doesn't already have a Part D plan or a Medicare Advantage plan with drug coverage. She only has original Medicare. So she applies for LIS, she's approved for LIS, so she needs to get her meds this month, now that she's been approved. She still doesn't have a Part D plan. Maybe we've enrolled her in one, but it's not going to start until November 1st. But Jane Doe needs her meds today, and it's October 1st. So in that case, she'll be enrolled. They'll automatically put her in what's called LINET, which means that she can still get her meds at a very, very low cost until her Part D plan kicks in. So if you tell anybody about that, their eligibility for it, that will count. Under Medicaid, again, we've already talked about submission, screening, assistance, recertification. The two we haven't talked about, again, if you explain to them what the MSP is or even Medicaid, check benefit explanation, good to go. Buy-in coordination. For people who have QMB, will allow them to get Part A if they weren't able to pay for it on their own. So if you discuss that with them, they call, can I get Part A? Well, let me check with TennCare and see what that's buy-in coordination. Also, they may have Part A. They never got Part B because they couldn't afford it. That's why they're applying for the Medicare Savings Program in the first place. And Part B, that'll go for any of the MSPs. Part A is only Q and B. But Part B, any of the Medicare Savings Programs will pay for that. So if you discuss them now getting their Part B once they get their Medicare Savings Program or Medicaid, that counts. You can select that box. And then, of course, preventive services. I have no earthly idea why that counts, but I'm good with it if they are. Alrighty. PM2, overall persons reached through outreach. So this is for when you go to do either an enrollment event, or you have a table or a booth somewhere at some sort of event, or you do some sort of presentation, whether it's in person, online, or something like that, you're doing a presentation. So that, of course, we remember as group outreach. So in order for that to count for MIPPA, we have to again, select MIPPA, yes. And then also we have to hit one of these target beneficiary groups as well as discuss one of these topics. So whereas the previous slide, it was or, on this slide, it's an and. So in order for it to count, your target beneficiary group, meaning that, I went to this presentation, I was targeting this group. You went to this event and it looked like a mixture of incomes. I know you're wondering how it could look like it. Let's say you're in a zip code that definitely has mixed income housing, and it looks like a good cross section of people from the neighborhood or from the community. So you can be said that I am targeting that group because we definitely know there's a nice percentage, well, I won't say nice, a decent significant percentage of low income in this area. So it stands to reason that I'm targeting that group. And then, of course, if your target group is rural, obviously, if you're in Lauderdale County, that is your target group. But even if you're, let's say, the Delta Fair, people come from all around. That's a huge event. So even that could say that you're targeting rural because you're expecting that not only people from Memphis, but people even in Henning might come to the Delta Fair. You have an expectation of that. So you select one of those. And for topics discussed, you have to select one of these four options: extra help, Medicaid, MSP, or preventive services. Because, yeah. Alrighty. For PM3, MIPPA target populations. So MIPPA target populations, PM3. Here we're back to the ORs again. So you have to have one of these target beneficiary groups. So bullet point number 1, you have to select that your target group was either beneficiaries under 65, rural beneficiaries, Native American beneficiaries, or beneficiaries with English as a second language. And, depending on where the event is, who the event is for. We recently had Latin Fest. So obviously, we can select beneficiaries with English as a secondary language. And no, I don't mean that because I think anybody who's going to Latin Fest that they all must not speak English. I don't mean that at all. But there definitely will probably be people there who may be older and therefore maybe they were born in another country or they were born here and they spoke Spanish first at the house and then they got to school and realized, oh, English too. I actually had it, well, forget older. I had a schoolmate out in California, born in Buena Park, California, and spoke Spanish at the house. Went to kindergarten and it was like, oh. So it doesn't even mean that they're not born here or anything. It just means that, you know, at the house we spoke one thing, at school we spoke another. So that's why I say Latin Fest, you can have a reasonable expectation of some bilingualism. Let's just put it that way. So we're not assuming that people don't know English. We're just assuming that some people have bilingualism. So if you have an event like that, you can definitely select that. If you're in Lauderdale, if it's a big group, let's say you actually went out to uh, someplace in Henning has some stuff for Choctaw Nation. So, you know, even that way you could get Native American beneficiaries. So you have to select that, and you have to select at least one of these topics, and it can be one of these or topics, and it's the same from the last page, so I won't go over those. Now, remember when I said PM3 is divided? Here we go. So PM3 target population number 1, beneficiaries under 65. Same thing as with the SHIP performance measure. Are they under 65? Are they receiving or applying for Social Security disability or Medicare disability? If you've selected both, you've hit that target population. Target population number 2, rural. We've mentioned that, so I won't belabor the point. Native American. The only reason I'm going to stop here is to let you know what counts for this target population. So if you select the option that says American Indian or Alaskan Native, or if you select the option that says Native Hawaiian or other Pacific Islander, if you select one of those, then that's hitting the target population. So if The Rock comes to town and you talk to him about Medicare, you know, he's Pacific Islander, that works. You'd be able to select black for him too, but he's Pacific Islander, so that works. And then the next target population, beneficiaries with English as a second language. We've talked about that, so I won't belabor the point. So now for performance measure 4, contacts with applications submitted. So in order for this to count, you would either have to, under Part D, low income subsidy, select application submission, or under Medicaid, select application submission or recertification. Because again, if they're doing a renewal packet and you're assisting them with that, then that would count. So one of these has to be selected in order for it to be PM4. And again, let's remember for any of these PMs to matter at all from MIPPA, you have to select MIPPA yes in the first place. If you don't select MIPPA yes, none of these other slides even matter. All right, so this brings us to the end of the first part of our webinar, which was the performance measures. So I've got our contact information there. You all know, or if you may not, so let me stop assuming. Most of you probably know our main number, 222-4111. This is our general mailbox. I got them to put that together sometime last year so that no matter who's here, if somebody's out one day or not the other, you know, people can check that general mailbox for ship.smp@agingcommission.org as opposed to it sitting around waiting in somebody's email when that person's gone for 7 days because they got a fabulous vacation and they're not checking their email. So if you put it in here, somebody should be able to get back with you. And then, of course, we have our Facebook pages. The Mid-South SHIP page is actually a volunteer page, which I am trying to step away from, but I'm not a Facebook addict, but you know, when I do one thing for Aging Commission, I kind of just, it's easy to just slide over and put it on Mid-South SHIP. But really and truly, we want that to be y'all, and I'm going to try to be better about that in the future. But Aging Commission has a page, and then we also have a Twitter page, and then of course our 10 SHIP toll-free line. So right now is a good time to have a stopping point. If anybody has questions about anything in this portion, let me go ahead and see. Oh, see, questions. And let me see. Feel free to unmute yourself if you want to ask over the phone or your little microphone, or if you'd rather type it into the chat, you can do it that way as well. Okay, let me see. Let me pull the chat back up. I saw it pop up. There we go. These things move. Okay, so we have a question from Alice. Okay, question when you get to next Q&A. Okay, let's say on the first contact, I did MIPPA screening and checked the appropriate boxes. Beneficiary has to check with doctors. During this contact after screening, she was above 150%. Next time she calls, we discuss more detail. The preventive services, should I check MIPPA? Yes. Because during this contact after screening, so you're screening her again, the second contact, 'cause that's how you found out this time around she's, oh no, I guess you're saying the first time she's above? Uh, yeah, I would still just maybe just reconfirm her income, or you can just mention something like, well, before we talked about that you were not eligible, unfortunately, for the extra help, but here's some help that everybody's eligible for, preventive services. So you can kind of get around it that way. If you feel like, hey, I already asked her the last time, why would I ask her again? But yeah, as long as you can kind of slide that thing in there, so at least you can say that I still screen them, then yes, you would check yes for MIPPA and then check preventive services, and that would be a new unduplicated contact because it's a new topic. That's a good one. Okay, any other questions at this time? And again, if you all just joined us or if you haven't had a chance to type your name into the chat box, it's that little cartoon bubble. If you click that, it should come up. I'm going to go ahead and pull up the next presentation, which is quite a bit shorter. Yay. But I'm going to go ahead and pull up the next presentation. And like I said, I'll definitely get these out to you all. In fact, well, I'll save that for a moment. So let's put that down. And let's pull up the next one. Okay, share content. Okay. So do you all see it's kind of mostly blue one? The other one had a lot of orange in it. Do you all see the one that's presentation? The one that says volunteer reporting and stars training? Can everybody see that? I just want to make sure I've got the right one sharing. These things can be tricky. Okay, now, yes. Okay, great. Okay, thank you guys. All right. So let me go ahead and put that on full screen. Okay, so obviously this was a separate one, but I'm incorporating it, so that's why you see this slide again. Obviously, we're going to go ahead and get started right now. But at least it does show you what the chat thingy looks like in case you came in late. So you can just select that and type your name in. Okay, so volunteer reporting, fewer decals this time because the other one, since it was performance measures, had to give credit to ACL and all those guys, but not here, or at least they haven't said they wanted credit, so I'm not doing it. But you do have the ones that we need to display today. So there we go. Legalism over. All right, so we're going to go over beneficiary contact forms. So basically, we're going over different ways that you can report data. And Tennessee SHIP, the folks in Nashville, even though we've done this a couple of times. So for those of you who've seen this, you're probably like, oh my gosh, they really wanted us to press this point. So they did ask that we repeat this information on more than one webinar. So my apologies if you feel like you've seen this before, but hopefully there's something a little new or maybe some more clarification that we can provide this time around. So we're going to go over beneficiary contact forms, alternative reporting measures. We're going to do a little introduction into STARS. There's actually a much more thorough STARS webinar that Tennessee SHIP did on their YouTube page. You can always pull that up. Or a lot of you may have seen that Tennessee SHIP has a new online training self-paced thing called Absorb. And if you wanted to view it that way, you could. So, you can always just let us know what your preference is. So I'll do kind of a minimalist, I guess I should say, STARS thing. And then we'll go over deadlines. All right, so the beneficiary contact form looks like this, unless you print it out in black and white, which I always often do. So otherwise, this is, oh, darn it. when am I ever going to change this image? I'm sorry, you guys. That's the old one. It looks mostly like this. We don't have drug passwords anymore or password dates. So that's gone. But everything else pretty much looks like this. Okay, I will update that. All right, so we use, oops, well, okay. So we use these when we are talking or emailing or mailing or whatever it is that we're doing with our individual contacts. We often use these in order to capture the necessary information so that when we turn around and put that information into stars, we have that. And also, it's just good to have in our files because, you know, if Mrs. Smith calls back a few days later, I can always just kind of reach in and grab it and be like, oh, okay, this is what she needed last time. And I kind of can jog my memory as to what's going on and everything. So it's helpful in that way too. But again, we'll go over some alternative measures of getting this information because not everybody either has access for this form or has the time to do this form. But this is typically what the staff members and a lot of our volunteers use. The required elements are asterisk, and you can see that. And you don't have to enter information into stars yourself, although you're perfectly welcome to do so if you like. It's not that hard, but I know some people, you know, that's too time consuming, and that's cool. You can just send it to us. You can fax it to us, you can mail it to us, you can email it to us, whatever floats your boat, and we will get that taken care of. You know, we do a lot of entering, and there are some volunteers, they like to do that data entry, so they'll enter it for you as well. So you can certainly do that. And yes, I can definitely send that as part of the email. Let me write that down. Send BCF, the real one, to everybody with the PowerPoint slides. Okay, so yes, so like I said, if you want to enter it in the stars, this is a good way to keep it by your side so you can enter it because it follows along with stars every step of the way. But if you're not able to do that, just send it to us. That's cool. And like I said, some people, we have in-kind volunteers who work at other social service agencies that may have their own version of this form, and we certainly don't want to supersede anything that your managers may have asked you to fill out as well. Basically, as long as you're able to glean, or we're able to glean the required information from whatever format you use, that's great. Okay, click. There we go. But yeah, so I'll send that around, and if we have time, and I think we will, I'll even pull a version of that up, but we'll get to that in a moment. So some alternative reporting measures can be sign-in sheets, especially if it's a group outreach. If it's a group outreach, we're not expecting that beneficiary contact form anyway, unless you just happen to talk to Cindy Jones on the side and you just happen to have one of those in your bag and you wanted to pull it out, that's cool. But otherwise, you probably just did a sign-in sheet. You can also report things to us by email. I've had people who just kind of wrote, you know, a paragraph about, you know, I talked to Becky Robertson on this date. It lasted 30 minutes. Here's what we talked about. She lives in the 38108 area and she's 62 years old. You know, so some people have done that on rare occasion. And then there can also be spreadsheets and chat logs. All right, so sign-in sheets, like I said, these are primarily used at outreach events. So presentations, health and community fairs, enrollment events. Typically, this is where we use sign-in sheets. The minimum information that we need for group outreach is the location and zip code of the event. So, you know, location meaning the county, because we know some zip codes have crossed into multiple counties, like 38002, that can be either Fayette or Shelby. 38063 can be Haywood, Lauderdale, or I think Crockett. Maybe just Haywood and Lauderdale. Either way. So you want to get that down. And then, if at all possible, if you can get the names and zip codes of the residents, because that can help you with the whole, did we target rural folks or not? You know, if you can look on your sign-in sheet and at the very least see that J.C. Smith is 38063 Lauderdale, Tom Smith is 38002, so that's not going to be rural no matter what county he's in. So, you know, that can be helpful. Now, preferably, you could also capture this information gender, ethnicity, age range, income, and topics discussed. So preferably if you have a detailed sign-in sheet that can capture this, that's great. Sometimes the host location has their own sign-in sheet, and they prefer you to use that. So get a copy. We just want to cause the least amount of disruption as possible. If they don't mind us having our own out, then by all means use ours, or whatever one that you come up with. But if the host location is more insistent, then just, grab theirs. And theirs may not, allow you to capture everybody's single, everybody individually, what their gender and ethnicity is. But that's when you can kind of just take notes at the event, read the room. So I've got a sign-in sheet. It shows me that we had 29 people, and just looking at the sheet and basically just eyeballing the room, we definitely had male and female, as well as others. Looking at the room, I could see people who visibly presented as, these ethnic groups are not, so things of that nature. Can't really eyeball income. So if you're able to, get that information, great. If not, there we go. And then definitely you want topics discussed. And that can be on the sign-in sheet, but it also can just be a matter of, if you know you're giving a presentation, then you already know what you're discussing because you have the presentation. Just like now, I know what I'm discussing with you because I've got the slides where I could just go back and mark that down. If you're at a health and community fair, whatever brochures and information you put out on the table, that's what you've made available. So if you have a bunch of information that talks about fraud and abuse, if you have some flyers that tell people about the Medicare Savings Program or the low income subsidy, or just a moment. Sorry, hold on. It's getting a little loud. Let me just, one moment. Let me put this on pause. Yeah, I've paused recording for a moment. So this would be a good time if you have any questions. I'm just trying to wait until it dies down a bit in here. I apologize. It's not yours, it's mine. It's my mic this time. Okay, I think that might be as good as it's going to get. So let's go ahead and wait. Nope. Okay, that really might be as good as it gets. So we'll just go ahead and resume the recording. Good luck. Okay, so okay, we're recording again. Okay, awesome. So, topics discussed. If you're at a health community fair and you have flyers about the low income subsidy, then you've got that. So anything that you've provided that people can come and pick up, you can use that as a gauge of the topics that you've discussed. And then, of course, at enrollment events, based on what you are helping people with, whether it's Part D, Medicare Advantage, or helping them apply for assistance, then that can also help you with the topics discussed. All right. Email. So like I said, if you're going to just email me or LaJoy or anyone some information, and I've got her email address at the bottom, then what we definitely need on the required side, on the left side, we definitely need the beneficiary's name, or okay. Stars doesn't actually have to have their name, but in order for us to at least search it, if you can't get their name, give us a pseudonym or maybe their initials, so we can do that, or at least the representative's name. We can put that under representative. But we definitely need that person's zip code. So even if they don't want to tell you their name, you can just say, well, do you mind if I just get your initials? Okay, KC, fine, KC. What's your zip code? And some people are real funny about that. Now just tell them, I can't mail you just based on a zip code, so don't worry about that. And then they'll usually give me their zip code. The location and zip code of the counseling session. So that's where you are. So wherever you are as you're doing this counseling, if you're on the phone, wherever you're sitting, basically. Now, some of our volunteers live just across the state line. So in that case, use our office zip code, which is 38103. But as long as you are within our 4-county area physically, whether it's on the phone, in person, web, whatever, you can use your own location unless you happen to be sitting just across the state line in South Haven, then just use our office zip code. Again, we need the topics discussed, the amount of time that you spent, and the method of contact. So we need to know, how did you contact this person? Was it over the phone? Was it email? Was it regular mail? Was it face to face at their location, at their home, or face to face in a counseling location? So we need that information. We would prefer if you could add the information on the right. The gender, the age group, receiving or applying for SSDI, income, race, and English as primary language. Actually, we prefer those. We definitely really, really, really want to hit specifically income, language, and whether or not they're receiving or applying for SSDI, which of course they can only do that if they're under 64. You know, people all the time will tell you they'll be 68 years old. Oh, I get disability. I just ignore that. They're 68. No, they don't. And they don't know that they don't. Unless I really feel the need to disabuse them of the notion, I just move on with that. But for your purposes, you know the answer to that question. All right. For outreach events, if you don't have a sign-in sheet, you just kind of took some quick notes to kind of represent what happened. Then again, what's on the left is what we really need to know: the name of the event, what type of an event it was. So again, there's only 3 things that qualifies, and you can see them there. An estimated number of attendees, the topics discussed, which again, if it's a health fair, you may not be talking specifically to a whole bunch of people, but the information you made available for them to pick up and or discuss with you if they had a question, and the zip code and location of where the event was. Obviously, if it's a presentation or an enrollment, you may be able to get more specific than that. Preferred, we'd like to have this information on the right-hand side. So if you are able to get that, great. And that would go a long way towards us meeting our performance measures. And again, you send this information to the volunteer coordinator, LaJoy White-Pollard. All right, so spreadsheets. Some locations have spreadsheets or are developing spreadsheets. I know we get spreadsheets from a couple of departments here at ACMS. There are some other locations which may just kind of make a spreadsheet of all the contacts that they've had maybe that week or that month, and they kind of like use notes in the spreadsheet. And then at the bottom, so if I selected 1 of 4, this means that I talked to them about Medigap and I talked to them about Part D. So yeah, if you're the type, or if you're at an organization that does it on a spreadsheet, feel free to do that. And then chat logs. This isn't going to happen often, but just in case, especially when you do online events, you can use the chat log for attendance. I've done that before. Heck, we're doing it now actually, where, having people just type their name into the chat. There have been times where I couldn't figure out how to download that thing, so I took a quick picture of it with my phone. So that can work as well in order to, because that can help you count, how many people were at this event. And now for stars, the way you log into stars, of course, you need to have a login, which you can, if you don't have login access, let us know, and we can get that started. But once you do, you would go to stars.acl.gov. Technical support email is right there for good measure. Now, stars, as we've mentioned on the PM side when we talked about performance measures, so just going to reiterate here, the key components: MIPPA, yes or no. If you discussed their income and resources at all, you want to select yes or no. And that's going to be one of those topics. Just the fact that you screened them or found out if they were eligible is going to be one of the topics under Medicaid or Part D LIS. So definitely select yes. Even if they're above, select yes. Send to SMP, yes or no. If you discussed fraud and abuse, or if you discussed preventive services, select yes for SMP. That's the Senior Medicare Patrol. It can be something as simple as, make sure that you keep your Medicare card in a safe place so that people can't steal your card number and try to, get services from themselves based off of you. That's a very quick and dirty way of discussing fraud and abuse. Or if you go into preventive services, so you want to select SMP, yes. The SIRS e-file ID in session. If you are doing stars on your own behalf, you don't have to worry about this. But let's say you send me your stuff and I'm entering your information, then I want to make sure that I put your name down, and I'm going to make sure that I put your SIRS ID, which I have a list of those IDs, to make sure they match. So I always want to be careful. If I'm doing it for myself, it's automatically populated as soon as I log in there. But let's say if I'm filling it in for Alice, or if I'm filling it Miss Alice, or if I'm filling it in for Miss Pat, then I want to make sure I select their names and then put their ID numbers. Anything that has an asterisk, if you're doing it yourself in stars, you'll see the asterisk ones. You must be completed. If you try to hit save, it will give you all sorts of big old red things at the top telling you, you didn't do this, you didn't do that. You have to select at least one topic, which has an asterisk. The special use fields, that's where we put the money in, I mentioned earlier. And then, of course, you want to hit save. And this all makes sense when I pull up stars in just a moment. Let me hit this and then I'll do stars. Deadlines for reporting information. So for ACL, Administration for Community Living, which is where the money comes from, they're congressionally funded. They send money down the chain to SHIP, to Tennessee SHIP and to Tennessee S&P, who turns around and sends money to the individual organizations such as the Aging Commission for the Regional SHIP. So there you go. So there are funding overlords. So for their purposes, they must have that information entered by the last day of the month that follows whenever that contact, whether it was a counseling or an event contact, was made. So today is October 1st. So the person that I sent an email to this morning, I've got until November 30th to get that information in for ACL's purposes. Now, ACMS, as you may know, is part of Shelby County government, and they have, they use our numbers too. Obviously, they need to report to the county what we're up to, make sure we're up to some good, not no good. So for their purposes, it would be more helpful if we could get things in by the 15th. And so that means that the email I sent to Dude earlier today, I would actually want to get it in by November 15th, because that would be very helpful for our local reporting. So yeah, the 15th is preferable. If you can get everything in by the 15th, we would really, really appreciate that. That would help us in-house greatly. I do say this, don't knock yourself out if you wake up the morning of the 16th and go, I missed it. Go on and get it in, because obviously ACL's not mad at you. And I'm not mad at you either. So the 15th, we want to put that in our heads. 15th, 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 15th. But if all else fails, you still have to the end of the month for Congress. For Shelby County, 15th. So just keep that in mind. And again, if you're not entering it yourself, get it to us by the 15th so we can have some time to get it in. Because the 15th, actually, that's builds in a couple of days for us. So if you can send us your stuff by the 15th, we'll be able to get that taken care of for you. If you do it yourself, that's great too. Okay, so if you have questions, feel free to go ahead and ask or put them in the chat. And while you're doing that, I am going to pull up stars. You can see that a bit. But while I'm doing that, feel free to either unmute yourself and ask a question, or to ask one in the chat. Stars, let me pull that up while you guys are doing that. I want to know what's new in Chrome. Sorry, the browser's being cute today. All right, let me share my web browser. Oh, I see we've got a question, so let me pull that up while that's working. Oh, not that one. Come on, chat box, come back, come back. Sorry, I told you, technology and I are being cute today. Okay, so what is the date of the latest MSP form, and is the last BCF form I sent the latest? That second question, I'll have to look. I believe so, but I'll have to look. The date of the latest Medicare Savings Program application is January of 2021. That was the last revised date. January 2021. So if anybody needs a more updated version of the Medicare Savings application, just let us know. We can get that out to you because it was updated January of this year, and that's the one that you want to use. Okay, so that's a yes. So let me just go ahead and add that to MSP application. Alrighty. Sharing a web browser, but not the one I want to share. Hold on. Okay, let's go back to share content. Okay, that's what I did wrong. I hit the wrong share thing. Sorry. Okay, so does everybody see where it says IntelliTrack, ACL, Administration for Community Living, blah, blah, blah? Okay, yes. And I see someone's been having trouble getting a password for stars, been sent several usernames, but no passwords. Send us an email about that, and it may be that you might have to email Booz Allen Hamilton directly if emailing us, because we forward it on to the state because they're the ones that deal with those sorts of issues. We email it on to Lori Galbraith, who is our Program Development and Quality Assurance Coordinator at Tennessee SHIP up in Nashville. And her email address is lori.galbraith, which is GALBREATH at tn.gov. Oh, why am I saying that? I could just type it in the chat. Hold on. Okay. And then for Booz Allen Hamilton, that'll actually be in the whatchamacallit, that'll actually be in the presentation that I send you, the one on the one that we just did, the one on performance, on reporting and data. There was a page where it said technical assistance and it had the Booz Allen Hamilton one. So when I send those around, you'll have that email address as well. Alrighty, so all right, so this is the page when you go to, well, actually, when you go to stars.acl.com, it'll ask you to select a button. And when you select that, then it takes you to this page. I have this page bookmarked, so that's why you're seeing it. So we're going to go ahead and, well, before I do that, I'm going to show you this. I'm just going to pause recording. This is the only part that will not be recorded simply because I don't like having you all are SHIP volunteers. You have access to data that we do for our beneficiaries, but I don't necessarily want that posted on YouTube. So let me hit pause the recording. Okay, so while that is, oh, that's not pausing it at all. Hold on a sec. Feel free to ask away. You can unmute yourself or you can type it in the chat. Okay, I do see a question. Here we go. So send to SMP should be checked when I discuss any fraud issue. Not that I'm trying to report a fraud issue. Yes. Definitely if you are reporting it, for sure. But yes, anytime you discuss it, if you, let's say you're mailing them information and you throw in a SMP brochure, or sometimes I have some handouts on different fraud topics like the genetic testing scam. I'm looking at it right now. I've got some flyers about the COVID-19 scams that were going around trying to get people's Medicare information. So because I'm sending them information on fraud and abuse, or if I discuss it over the phone in a conversation, whatever it is, yes, send to SMP is anytime you discuss anything related to fraud and abuse or preventive services, but also definitely when you are reporting an issue. Okay, great question. Many other questions there? And actually, since I am on this, let me pull up that slide that has the technical support for stars, since I'm looking at it right there. All right, so Booz Allen Stars Help Desk at BAH.com. So that's for anybody who needs that. And again, I will send these to everybody. And in fact, I believe there's a way for me to, there's supposed to be a way for me to send it to you guys while we're even in the meeting. But I can't find it, so I'll just email it to you. Sorry. I wish I was a bit more savvy on this program. Every time I think I've learned something about it, I unlearn another part. So, any other questions about either reporting, stars, the performance measures, or just a question you thought of about volunteering that has nothing to do with today, but it's on your brain and you really want to get off your chest, go ahead and ask. Oh, and one more time, I think most of you have, so forgive me for being a broken record, but if you have not signed your name into the chat, please do so just so we can have a record of your attendance. All right. Well, if there are no other questions, just to reiterate, I am going to send you both PowerPoint slides as well as the BCF form. So if anybody needs to use that, they can, as well as a copy of the most updated Medicare Savings Program application in case anybody needs that paper copy and would like to use it. And again, of course, you can always do that over the internet, and it'll have the web address at the top of that application on the first page. Oh, thank you guys. I really appreciate your attendance and the really good questions and your participation. Thank you. Thank you very much. Well, as the preacher says, all hearts and minds are clear. So if that's all, I think we are coming up on the end of our time allotted. Actually, we've got about 3 minutes left. So just to make sure we don't go over, I guess I'll go ahead and end that. Oh, thank you. Thank you for putting your name in the chat. Yeah, I'll just leave this up. I'm gonna go ahead and stop the recording now since we are at the end. But for those of you who are still putting your name in the chat, feel free to do so because we are still available for that. And if you would like to participate in next week's webinar, on preparation for Medicare annual enrollment, go ahead and just drop us an email if you haven't already done so, and we can get you signed up for that.